everyone, welcome back to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. I'm so excited that you're here, and I'd like to remind you to subscribe so you don't miss out on any of the other great videos we have coming out. We publish every Tuesday and we talk about all things rheumatology, immunology, diet and movement, mental health and wellness, because we believe it is all connected. So today is all about back pain. Now, back pain is everywhere, so much so that most of us at some point in our life will experience back pain. If you've ever gone to a doctor with back pain, it's most likely that the doctor hasn't been too worried. And I know that there are tons of horror stories on the internet about patients finding out they have cancer and their only symptom was back pain. So what I wanted to talk about today was, what kind of signs should you look out for to know when it's time to call your doctor versus when it's just time to rest? So let's get into it. Okay, so back pain is a huge topic and is the subject of multiple lectures that medical students have. But I do think there are some key points that we all need to know so that we can judge when something needs to be taken to the next level and discussed with our doctor versus we just need to take an ibuprofen or a Tylenol and use a heat pack and rest. As I said before, back pain is very common and most of us will have a bout of it at some point. And the type of back pain that most of us have, we call acute or subacute back pain. And that is back pain that lasts less than 12 weeks. Now, for most of us, we will never find out the reason we develop back pain. And that includes patients who undergo blood work or have an MRI. Things that put you at risk of having severe back pain would be having a physical job, being overweight or obese, smoking, having diabetes or a mental health disease, or having had an episode of back pain in the past. Now, treatment for this kind of back pain usually involves pain relievers, heat pads, ice packs, physical therapy, and adjusting our daily activities. What worries most people, however, is when the back pain becomes chronic. So that is when the pain lasts longer than 12 weeks. Now, even this kind of back pain, oftentimes we don't find a cause for it, which can be super frustrating. And when back pain doesn't get better, it is inevitable that we become concerned that something more sinister is going on. Now, lasting more than 12 weeks by itself is not necessarily a sign that something more dangerous is happening, but there are some clues that we as doctors are trained to look for that let us know that we need to take it seriously and maybe do some more tests. And that's what we're going to get into. So number one, you're having other symptoms besides the back pain. So what do I mean by this? So you want to think, are you having fevers? Are you having chills or sweats at night? Have you lost weight without trying? As I've said in other videos, we oftentimes have to think beyond the pain that we're experiencing to try to figure out where it's coming from. So you might go in to see your doctor worried about one thing, one area that has pain, and they might then start asking you a bunch of questions about symptoms that you actually had never thought about. So if you are experiencing any of those things, such as fevers or unintentional weight loss, then you absolutely need to go talk to your doctor. Number two, you're having bowel or bladder incontinence. So first of all, what is incontinence? Incontinence is not being able to control when you need to go to the bathroom. So this is, you might feel the urge, but you're not able to make it to the bathroom, or you might not even feel the urge. If you are having that and you're developing back pain, then you absolutely need to go talk to your doctor, and they will most likely set up tests to be done that day. Now, why is this such an issue? Why do we need to take this so seriously? Well, our spinal cord runs the length of our back, and that spinal cord has offshoots of these nerves that go and innervate our entire body. So we have nerves that come off and innervate our arms, our organs, and our legs. If you are having bowel or bladder incontinence and you've lost the ability to control when you need to go to the bathroom, then that can indicate that the nerve that is leaving the spinal cord and going and controlling the bladder or controlling the bowels is being pinched and isn't able to work correctly. And that's an emergency. We need to figure out, number one, why it's happening and what we need to do about it. So if you're having those symptoms, then you absolutely need to call your doctor, and you will most likely have a bunch of tests done that day. Now, a third clue that we look for when we're trying to figure out if we need to take back pain seriously is if there has been any recent trauma. Now, this one might seem a little bit obvious, but sometimes it's not easy for us, or we don't naturally put two and two together. So if you've had any kind of physical trauma, like a car accident or a fall, and then you develop back pain maybe days or even weeks later, you need to go see your doctor, because things can still pop up from a trauma that happened a few weeks before. Another thing you always need to keep in mind when you develop back pain is if you have had recent surgery in your back or you are immunocompromised. Immunocompromised meaning that your immune system, for whatever reason, maybe you have an autoimmune condition, maybe you're on chemotherapy or strong medicines that lower your immune system, but whatever the reason, being immunocompromised just means that your immune system is not working at 100%. So if either of those circumstances applies to you and then you develop back pain, then you absolutely need to talk to your doctor. And the reason is that both of those scenarios put you at a higher risk of developing an infection in your back. And lastly, muscle weakness. If you start noticing that things that used to be easy are now a little harder for you, if you can't raise up your arms, you're having a hard time getting in and out of the car, that can be signs that your muscles are getting weak, and that combined with having chronic back pain could indicate that you're having nerve problems. So it's a very similar concept to what we talked about with the bowel and bladder incontinence. Those nerves leave the spinal cord and they go and they control all of our muscles. And if any of those nerves get pinched from arthritis or from anything else, then that can ultimately lead to the muscle not getting the signal it needs to get to be able to contract, and we can lift our arm or lift our leg. So if that's happening, then you definitely need to talk to your doctor so that they can run tests to figure out, number one, why this is happening, and number two, what they can do about it. So these items we all learn in medical school are called red flags, and they're things that we're taught to look for and ask when a patient comes to us with back pain to try to figure out if it's something that we need to worry about or not. I do want to add a few things to this list that as a rheumatologist we also take into account. It's not necessarily something in those red flags list, but as rheumatologists we tend to look at back pain with a little bit of a different scope, and so I want to throw these in there just for good measure. The first thing is morning stiffness. Now, I know I've talked about morning stiffness when we talk about rheumatoid arthritis and osteoarthritis, and it goes the same for back pain. It is very common to have some mild morning stiffness, especially as we get older, but this is morning stiffness that should work itself out in the first 5 to 10 minutes that we're up in the morning. So by the time you go and get your coffee, you should notice that you're feeling much better. Morning stiffness that goes beyond that is usually something that we look into. I'm not going to say we worry about, but we definitely look into. So if you notice that it takes a good solid hour for you to get moving, then you need to call your doctor. Another thing that rheumatologists will look for is if you're having joint pain in any other joints aside from the back. Now, run-of-the-mill back pain is just that. It's just back pain. It's not typical to then also develop hip, knee, shoulder, or ankle pain, and certainly not typical to lead to joint swelling. So if you start noticing that what started out as back pain is now back pain plus ankle pain, and then maybe a shoulder hurts, that needs to be investigated. That's not your run-of-the-mill back pain, and you should probably go see your doctor for that. And then finally, rheumatologists are going to ask questions looking for the evidence of what we call inflammatory back disease. So these are things like ankylosing spondylitis, uveitis, arthritis associated with inflammatory bowel disease, and psoriatic arthritis. I know I just threw a lot of big words at you, but basically these are inflammatory or autoimmune conditions that oftentimes are associated with back pain. And sometimes the back pain might actually be the first sign. So what are some other signs? Well, if you're developing new rashes that you never had before, if you're getting bouts of really red, painful eye symptoms, if you're having abdominal pain, belly pain associated with diarrhea, and if there's blood in that diarrhea. These are all signs that this is not your normal back pain and we need to take a look. The point here is not to scare you into thinking that you have a horrible disease and that you need to go see your doctor for your back pain. In fact, most of us don't. So much of our worry comes from when we don't know when to be concerned and when not to be concerned. The default is always going to be, when you're unsure, make an appointment. But knowing what the doctor is going to be looking for and what kind of questions they might ask will just put you that much further ahead. As always, thank you so much for watching. If you like this video, make sure you give it a thumbs up. I'd love it if you subscribed. That way you won't miss any of the other great information and inspiration we have coming. We drop videos every Tuesday, not Thursday, every Tuesday, where we talk about all things rheumatology, immunology, diet and movement, mental health and wellness, because we believe here at Connected Rheumatology that it's all connected. Thanks so much, and we'll see you next time.